Hello everyone, so welcome to my YouTube channel. So I'm still looking at the question that someone said to me regarding exam of American Society for Clinical Pathology exam. Okay, so I'm going to be providing some suggestion again, then hopefully that will help you to make right choices if you do go for that exam. All right, before we continue, my name is Dr. Emmanuel Ogbodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So yeah, let's look at the second part of that question, okay? Right, so now look at this question. This person has been asked, refer to the following data. Refer to the following data. Which data are they talking about? The forward grouping and reverse group. That's the data they are looking at. Now, I want you to stay with me. This is still talking about ABO discrepancy. Remember that anytime your forward group is not agreeing with the reverse group or reverse group is not agreeing with the forward group, that's the problem. If you look at the first question that I look at regarding this, I think on my previous video, the discrepancy was on the reverse group because there was a weak reaction on A1 while the patient is what blood group A, okay? And that was why we have to investigate that. But now let's look at this one. So I'm trying to say ABO discrepancy means forward grouping is not agreeing with the reverse grouping or reverse grouping is not agreeing with the forward grouping. If there will not be any discrepancy in the ABO grouping, it means that the forward grouping will be agreeing with the reverse grouping and reverse grouping will be agreeing with the what? Forward grouping. Anytime these two are not agreeing, that is called ABO group discrepancy. And there are many factors that can lead to that. And like I mentioned on my previous video, while I was trying to answer this type of question, what that interfere in the previous ABO discrepancy that we had looked at, before this one, has to do with autoantibody. So let's continue with this, okay? Now, if you look at this person is blood group. This person reacts on the forward group because in the forward group, we are using the patient red cells. In the reverse group, we are using the patient serum, okay, or plasma as the case may be. So now the patient red cell reacted with this anti-A, which suggests that it is blood group A. And of course, B is negative, which means that it is blood group A. If this B is positive, maybe we can say it's blood group A and B. But anyway, B is negative, so it's definitely blood group A, okay? Because in ABO grouping, it has to be either antigen A or antigen B or both antigen. Again, or antibody A or antibody B or both of them, okay? Now, because only blood group A here is positive, B is negative, this is already suggesting that this is blood group A. Okay, but now there's another type of test that they do, which is called Anti-A1 Lectin. Okay, so this Lectin test, okay, is used to differentiate the blood group where possible. For example, especially in blood group A, you can have blood group A1, which is a common one, okay, that has about 99%, okay, but you can also have blood group A2. In fact, you can even have blood group A2B. Okay, something like that. Okay, now, but that A2 is about less than 1% or 1%, like I've mentioned on my previous video. Okay, so the point here is that in an attempt to find out which type of blood group A is this, they now did anti-A1 Lectin test. Okay, and that again showed a strong positive reaction. Let me say this before we continue. In blood banking, it's important that in addition to the result you are getting, the strength of the reaction is also very vital. It's not just that it is positive. When a reaction is strong, most time it is suggested that this is actually what is going on. Most time when a reaction is weak, there can be something interfering with it. It can be a number of reasons, okay? So it's important that in blood bank, you also consider the strength of the reaction. Anyway, let's continue. So looking at the strength of the reaction here, which is plot 4, which is the same thing with this very anti-A. This is obviously blood group A1 group, okay? This person is blood group A1. That's just what it means, okay? Now, that's what the forward grouping is saying, okay? Now, let's look at the reverse grouping. So, if this person is blood group A1, obviously blood group A, it means that this person does not have anti-B, because blood group A has antigen A and antibody B. And this forward grouping is measuring the antigen, not the antibody. So, in the reverse grouping, it should not have antibody A, but it should have antibody B. So if you look at these very A1 cells, so this is commercially prepared A1 cell, like I've mentioned to us on my previous video, okay? These are commercially prepared anti-A, that's antibodies, okay? So they use commercially prepared antibody here to detect the antigen, which is the patient blood cells, okay? But here they use commercially prepared cells, okay, to detect the type of the antibody in the patient plasma. Anyway, so the patient plasma or serum is saying that it is not specific to what A1 cell, meaning it does not have antibody A1. That's what he's saying here. Now, before I come to the second one, now he's saying that it does have antibody B, which is this B cell. You can see it is strong reaction as well. So because it does have antibody B and it is a strong reaction, it is important to now know that this patient, obviously, this somehow is agreeing that this person is what? Blood group A1. So it doesn't have the antibody A1, okay, but it does have antibody B. So it's agreeing that it is what? Blood group A1. However, there's a discrepancy. The discrepancy here is the fact that the A2 cells is positive. Why? It shouldn't be positive ideally, because this person, from what we can see here, is A1. What is the A2 doing here? So you would expect that perhaps this person, this is supposed to be negative because it doesn't have it. It shouldn't have it. Okay. The antigen that it has is A1, and any blood group that is blood group A will naturally produce antibody B, and it should not produce this very, anti-A2. So this anti-A2 is very, very surprising. Okay. Now, there are other things I want to mention here. I have said that this very blood group A2, they are less than 1%. They are not common. Okay. And even if they are to be expressed, okay, it can be more sensitive, at lower temperature than 37 degrees, if that makes sense, okay? So we don't know why this is here, okay? So again, if you can refer to the previous video, okay, that I had mentioned in terms of following up this one, okay? So now, there's a video that I made before this one. So you will see that perhaps there's also maybe a cold antibody here that, again, trying to mimic these very A2 cells, because these A2 cells is more sensitive at the lower temperature, at room temperature, if that makes sense, okay, at cold temperature. So it is mainly sensitive there. And let me also say that it's A2 cells, for example, if it is A2 blood group, the person is may likely develop anti-A1, okay, because I've said that the percentage of the A2 is less than 1% or 1%. Very uncommon, okay, and again is weakly expressed, okay, and because of that, even when expressed, it is expressed at a lower temperature than 37 degrees. So, but someone that is A2 cells, because of the more of A1 cells, if you give the person blood group A, the person is likely to develop it, okay, because that A1 is strongly expressed. But because of the weak expression of A2 cell, even if you give the person blood group A1 cells, it's unlikely that it's going to develop, antibody. But I'm saying it to say that this is very surprising. I am speculating that perhaps there is an antibody that is mimicking these very A2 cells, and I want you to note the fact that the A2 cells can be weakly expressed at the low, and they can be commonly expressed at the lower temperature. Okay, just take note of that. Now let's continue. Then I ask, which of the following antibody screening result would be expected, would you expect with this ABO type of discrepancy above? So looking at this like this, what can we escape? What can we expect? Like I said previously, let's dive into the science first, then we can now begin to talk about it. First of all, I'd already mentioned that the forward group here is a suggestive of what? A1 blood group. I said that already. Okay, now again, you look at the reverse group. A1 cell being negative confirm the forward group. I'd already said that, okay, because this A1 cell is negative here, it confirms that this person obviously is blood group A1, okay. Now, because obviously this cell is positive, okay, strongly positive, which again confirms that this person is blood group A, okay. Now, again, but the problem here is the fact that the reverse, which is A2 cell, is positive. This is unexpected, like I've said. This shouldn't be the case. It's saying that this person has anti-A2, which is unlikely. Because of the weak expression of anti-A2, or weak expression of A2 cells, okay, even if let's say for some reason this person was transfused with blood group A2 cell, it's unlikely that the person should produce, antibody A2 cell. Therefore, it is possible that there is something antibody, some type of antibody or non-specific antibody that is mimicking this very A2 cell, okay, binding type, and that is what I think may be going on here. So that's why I said unexpected anti-A2 is seen here, and this could be maybe not real. This could be due to something mimicking anti-A2. Okay, that's what I think anyway. Now, what can we do then to confirm this test? If we're going to confirm this thing, because in fact, it's also possible that this could be due to systematic error, it could be due to random error. Maybe there's a technical error, there can be, personal error. So it's important that we may have to consider to repeat the blood group. We may also have to consider to do something like antibody screening test, antibody panel. We may consider to pre-warm the sample because, like I said, A2 is mainly sensitive at low temperature. Maybe when we pre-warm the samples and repeat it, maybe it will not be seen as well. Then we can consider something like code panels. Okay, so we can look at some code panel like maybe LUEA, LUEB, and even P1, even anti-I, and so many of them. Okay, we can look at those code antibody and do code panel and see if maybe that is what is interfering here. What I'm trying to say is that this result we're seeing here is very unlikely. If this is the case, if it is not a human error, if it is not a technical error, if there's no any mistake somewhere, possibly it could be that there is a code antibody or a particular antibody that is mimicking this very anti-A2. That's what I'm saying. And I'm using the word code antibody because I'm saying that this A2 commonly is expressed below 37 degrees. I hope that makes sense. Yeah. All right. So now the question now is that what answer are we going to take? The question is, which of the following antibody screening results would you expect with the ABO discrepancy seen above? Which one? Is it going to be A, negative? Is it going to be B or C or D? So let's look at that. Let me show you what I thought about. One, I said that it cannot be, it's very unlikely that it's going to be negative. Let me tell you why. If you do antibody screening, why I said is unlikely is this. If it is actually anti-A2, if it is A2 antibody, that means you can't get a negative result. It has to be positive, okay? Something somehow have to show up in the reaction. Even if it is antibody that is mimicking A2s, something will show up somehow, okay? There can be a reaction. To see all the screening cells negative is very unlikely. There should be a certain kind of reaction that would demonstrate that, yes, there is something going on here, which is maybe anti-A2 antibody, okay, which is likely to show some reactivity, or maybe especially maybe cold antibody, as the case may be, because it's mainly seen under low temperature. I hope that makes sense. Okay, so if the antibody screening is negative, I wouldn't be suspecting a negative antibody looking at that discrepancy I'm seeing above, because I'm saying if what I'm seeing above is correct, that antibody screening may not be negative. You should see some level of some kind of reaction, whether it's a weak reaction. You should be able to see it. Okay, so I wouldn't go with A. Now B, I also say I won't go with B. The reason is this: they say positive with all screening cells at 37 degrees. Now I had already told you that A2 cells are more sensitive. They are more expressed, they are more active at lower temperature. So if you are getting a result that is all positive at 37, I doubt if it is A2 cells. I doubt if it is A2 antibody, rather. Okay, I doubt if that is the case. This is because we can see at 37, we are likely to see alloantibody. Okay, and which can be mainly warm reactive alloantibody. That's what you are likely to see. So because this place will measure, it measures a warm reactive alloantibody, not cold reactive alloantibody. And I said that this A2 antibody is commonly seen in the lower temperature. So at 37, you will not actually normally see A2. It will be very surprising to see A2 antibody at 37. Okay, right? I've answered that question. So it will not be A from what I think. It should not be B from what I think. Okay. Now, I say it could be C, and these are my reasons. Let's look at the point there. They say positive with all screening cells at, not the room temperature. So, but the auto control is what? Negative. So what is going on here is the fact that there can be possibility of what? Co-reactive alloantibody. Remember, I said this thing we are seeing here is unlikely. This person obviously is A1 blood group, okay? And it is unlikely for A1 blood group to develop antibody A2 because A2 is weakly expressed. It may be more easier for blood group A2 to develop antibody A1 than the other way around. So this is very unlikely. So what I'm thinking is that there can be some antibody that can be commonly seen at the same temperature with that of the A2 that is mimicking this very O2. That is mimicking this very A2. That is why I say that possibly this is the answer. And this is because the auto control here is negative. And if the auto control is negative, that means this patient is A1. And because it is A1, when you mix the A1 against the A2, when you mix the patient A1 cells with the patient A1 serum or plasma, it's going to be negative because it doesn't have the A2. It is unlikely that it's going to have the A2. That is why, because the auto control is negative, is a strong confirmation that this is A1. Perhaps this reaction we are seeing at the room temperature is a cold reactive alloantibody that is mimicking these very A2 cells or A2 antibodies that are commonly seen at lower temperature than what 37. That's why I think that this is the reaction, the answer. So I will definitely going to go with what C. Okay. Now, but let's still answer D. D, I said that it cannot be D. The reason why I think it cannot be D is because it said positive with all screening cells and the auto control cells at the room temperature. That is unlikely. The auto, it can be the auto. This is because we've already saying that from what we can see here, this person obviously is A2. Sorry, is A1. This person obviously is A1. What we don't know, how we seeing A2 here. Okay, and A1, okay, is strongly expressed at 37, not at the room temperature anyway. Okay, and you can see that the reaction here is strong here, is strong here, is strong here. In fact, even the anti-A1 Lectin is already a strong confirmation that this person is A1, because we use it to differentiate A1 or A2. So this already confirming that this is A1, and A1 is not commonly expressed at the room temperature. You can see it strongly at what 37 degrees. And to make this, to also confirm that it will not be D, is the fact that the auto control is positive. They are claiming that the positive in all screening cells and also positive in the auto control. It can be. There's no any way the auto control will be positive, because if the auto control is positive, you are invariably saying that this person is actually A2 or have antibody that is kind of mimicking that very A2. That is very, very unlikely. It cannot be A2. It cannot be antibody A2. Okay, so I say it's unlikely because this can be commonly seen in cold reactive auto antibody. Let me also say this: if it is actually an auto antibody, perhaps you're going to get a pan reaction here. Okay, this place may not be negative, it's going to be positive. Okay, and this place will be positive and this place will be positive. So I don't think that it is auto antibody. Okay, so like I've said, the reason why I'm going with C is the fact that I strongly believe that this anti-Lectin, anti-A1 Lectin has confirmed that this person is blood group A1, blood group. Okay, and if that is the case, A1, if you do the auto control, is going to be negative because it's not going to have antibody A2. Okay, and of course I've said that this very antibody A2 is commonly expressed at what room temperature, expressed at room temperature, compared with that of the A1 that is strongly expressed at what 37 degrees. So that's why I'm going with positive with the screening cells at the room temperature, meaning that the antibody interfering, the antibody we're seeing here is actually a cold antibody that is positive in all the screening cells at room temperature. However, when you look at the auto control, it is negative, meaning that it has nothing to do with the patient sample as per the patient having auto antibody. This has to do with maybe a kind of another cold allo antibody that may be mimicking that very A2 cells that is causing this very interference. I hope that makes sense. So the answer I'm picking here is C, and I'm picking it on the basis that I strongly believe that this very A2 cell that is positive can be due to interference of co-reactive allo antibody. So this patient perhaps has alloantibody, has developed antibody, or has an antibody that is sensitive, that is more expressed at lower temperature than 37, at cold temperature, and that is why it is expressed here. That is why it's interfering with the result here. So anyway, that is the answer that I have for this. Let me know what you think. This is just my own observation. This is also my own recommendation. This is what I think. I don't know what you think, but do let me know what you think. So now, like I've said, one of the ways you can help to know, because there are many, I thought I should give us this as a more information, because there are many cold antibodies. Somebody may be asking, so what are the cold antibodies? Basically, it's talking about those antibodies that you can commonly see, that are commonly expressed at the lower temperature than 37. Maybe you can see them at the room temperature, or even the one lower than room temperature, maybe at 4 degrees. Okay, so these are called cold antibodies. Okay, so now the key word is I love cold morning happily. Just know it. I love cold morning happily. Okay, so that I love cold morning happily is talking about that I is anti-I. Okay, love there talks about anti-LUEA and anti-LUEB. Now you now have code there talk about cold antibodies, whether you're talking about code anti-M, whether you're talking about code anti-N, as the case might be. Okay, now you now talk about happily, and then you are looking at something like anti-H. I hope that makes sense. Okay, now obviously morning, I miss morning there. Morning there is also talking about anti-M or anti-N, as the case may be. And of course, these code antibodies, like I've said, can also be the anti-M, anti-N, or maybe it can be maybe other type of code agglutinins antibodies, or code antibodies like code autoimmune, like you can see in a case of code agglutinin or something like that. Okay, so I love cold morning happily is one of the ways that can give you idea of the possible code antibodies, like I've mentioned. So anyway, like I've said, I'm going with C. Okay, because I strongly believe that this is a cold alloantibody that this patient has that is interfering and giving a false positive on the A2 cells. I don't believe that this person has antibody A2. Okay, I only believe that interference is because antibody A2 is commonly expressed at room temperature, at lower temperature than 37. So any other antibody that can be commonly expressed at that same temperature may have been the one giving us this interference. That is my final answer to that. Okay, all right. So yeah, thank you very much for listening. Let me know what you think. Let me know if you have any questions. Like I've said, if you have experience, you've been working, or you've taken this exam, there are other thoughts you think that I missed, feel free to add it in the comment. It will help the listener to continue to improve and understand what is being said here. But otherwise, thank you very much for listening. And please, can I ask you to like, share, and subscribe? It's important that you subscribe to be a good fan of this very YouTube video, which has helped many people. So please subscribe and share with friends and family. One more time, I want you to feel free to contact Too Good Consultant Limited. We are always here to help you, to support you, to prepare for your interview. We can also help to support you, with your academic support. We also help you. We can also help you with your career in any type of support that you need. Feel free to contact Too Good Consultant Limited. Of course, you're going to see our contact. You see our contact or detail using our Too Good Consultant Limited website, or maybe on the YouTube channel. If you check it, you can see it there. You can see some of our contacts. So feel free to contact us for any of this very help that I've mentioned. All right. I wish you all the best till I come back your way again. Bye-bye.